Good morning, ma'am.
Good morning. Good morning to all of you. Okay, let us start the class. So yesterday we were discussing on primary health care. We have learned about the principles of primary health care and also the essential elements of primary health care. So someone read out the 8 essential elements of primary health care. Anyone can read out, whoever were present yesterday. Carly, you were present?
Oh, no, ma'am.
Absent, okay. Binam. Shilonok present yesterday. I think you were present. Hmm? Were you present? I think you have network issue. Others who were present, Kostov present yesterday.
Yes, ma'am. Yes, ma'am.
Okay, read out the 8 essential elements of primary health care.
First point is the education about health problems and methods of identifying prevention and control. Second point, literally endemic disease prevention and treatment.
Locally. LOCALLY.
Yes, ma'am. Expanded program of immunization against major infectious disease. Fourth point is mutual and children health, including family planning. Fifth point is essential drugs arrangement. Sixth point is nutritional and food supply. 7 point is treatment of common infection. 8 point is some water supply and sanitation control.
Not some, safe, SAF is safe. Safe water supply.
Yes, ma'am.
Okay. Okay. Now write down healthcare system. Write down the topic healthcare system and underline it. Healthcare system, underline it. Healthcare system, write in block letters, underline it. Then below you write primary health center. Write down primary health center. Subheading you write primary health center, CENTER. Put a dash and write first contact point, 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 first contact point between village community, village community, village community, COMMUNITY, between village community and the medical officer is primary health center, primary health center, primary health center. Full stop. Okay, first contact point between the village community and the medical officer is primary health center. Okay, primary health center means where the patients are taken care of, where you can go with your health issues. Okay, it is mainly in the community and rural areas. Full stop. Next, below you write staffing pattern. Below you write down staffing pattern. Staffing. STAFFING. Staffing pattern, underline it. So in primary health center, as primary health center is a hospital, so it is a center where patients can be treated. So it should also have a staffing pattern. How many staffs are there? How many doctors are there? Okay, how many nurses are there? How many pharmacists are there? How many lab technicians should be there? So this is known as staffing pattern. Okay, like for example, in downtown, for example, in downtown, how many students are there? How many chairs are there? How many tables are there? How many teachers are there? How many principal is there? How many dean? How many associate dean? So that is the staffing pattern. So write down staffing pattern. Below, write down medical officer. Number one, medical officer. MEDICL, medical officer. Medical officer, write down one. Medical officer, in the same line you write one. That means there should be only one medical officer, MO. Okay, medical officer one. Below you write number two, nurse midwife. Number two, nurse midwife. MIDWIFE, nurse midwife. You write down one. Nurse midwife, write down one. Okay. Next, below you write number three, pharmacist. Number three, pharmacist. 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 One. That means there should be at a pharmacist. Only one pharmacist is required. Okay, in PHC. That means primary health center. Okay, pharmacist one. Number four, write down number four, health worker female. Health worker female. Health worker female. One. Health worker female. Acha, in bracket you write ANM. ANM. ANM is also a nurse. Okay. Auxiliary nurse midwifery. ANM. So in bracket you write ANM. You write one. Only one ANM nurse is required. Okay. Health worker female. In bracket ANM. And you write one. Next you write block extension educator. Number five. Number fifth one is block extension educator. Block extension, block, BLOCK, block extension, EXTENSION, block extension educator. One. Write down one. That means block extension educator should be only one in number. Okay, and the duties of this block extension, what is the meaning of block extension educator? What does they do is, their duty is mainly for identifying the educational needs of the people. Okay, especially for MCH, that means maternity and child health, family planning programs. Okay, in all these things, they are present. Okay, they identify and they are also required for educational needs. Okay, they mostly collect information relating to maternity and child health, family planning. Okay, next you write number six, health assistant female. Health assistant bracket, health assistant in bracket you write female. Write down one. Health assistant female one. 1. Next you write number 7. Health assistant bracket male, 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 write down 1. One. Then you write lab technician, number 8, lab technician, LAB, lab technician, lab technician 1. Lab technician 1. Only ETA lab technician is required in primary health center. Okay. Lab technician 1. Next you write number 9. Number 9 you write UDC and LDC. UDC capital letter, LDC capital letters, all in capital. U capital, DC all capital. UDC and LDC. Write down 2. 2. UDC and LDC 2. In bracket you write 1 each. Mane ETA UDC and ETA LDC. That is why it is 2 in number. Okay. 1 each. In bracket you write 1 each. EACH. 1 each. What is LDC? Full form anybody knows?
Lower division clerk.
Yes. And what is the full form of UDC?
Upper division clerk.
Okay. So 2 in number. 1 1. Next number 9. Oh sorry. Number 10 you write driver. Driver. DRIVR. Driver. In bracket you write if vehicle is there. If vehicle is there. If vehicle is there. In bracket you write if vehicle is there. One you write 1. Only 1 driver is required. 1. Next, number 11. Total number of staffs. Total number of staffs. Total number of staffs, you write 14. 1 4. Next. Oh, sorry. After driver, you write class 4. After driver, you write down class 4. Class 4. 1 4. Class 4. You write 4 in number. 4. You write down 4.
Glass 4, ma'am.
Class 4. 1 you can write in Roman letters. Class 4 means the very low grade workers. Okay. Who are like sweepers and all. Class 4, you write 4. 4 is required. So now you write total number of staffs 14. Total number of staffs 14. So this is the staffing pattern of a primary health center. Okay. Next you write community health center. Community health center, CHC in bracket. And you should also know the full form. Okay. I might ask you the full form CHC, you should know community health center. If I say PHC, you should know primary health center. So primary health center staffing pattern is done. Now you write community health center, CHC, underline it and write it has 30 it has 30 indoor beds. It has 30 indoor beds I and in DOOR. It has 30 indoor beds, BDS beds, Bisna, okay, beds with 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 one OT means operation theater, okay, with one OT, comma, X-ray. It has 30 indoor beds with one OT, comma, X-ray, comma, X-ray, comma, labor room, labor, LABOR, labor room, LABOR, and laboratory facilities, and laboratory facilities. And laboratory facilities. LABORATORY, laboratory facilities. So in community health center will be a bit is bigger than your PHC. PHC is mainly in rural areas. So community health center will come under urban. Okay, it will be mostly in town areas. So there are 30 beds. Okay, the capacity is 30 beds. At a OT room, there is one OT room. Okay, X-ray room is also one. Labor room is there. Labor room means not where the laborers will work. Okay, labor room means where there will be delivery. Okay, where the pregnant mothers will be brought in for delivery, whether be it normal or cesarean. So labor room and laboratory facilities. There will be laboratory facilities. Full stop. Below you write staffing pattern. Write down staffing pattern. Staffing pattern. Staffing pattern. Below likha number one, medical officer. Now medical officer, medical officer, medical officer in bracket, open a bracket and write surgeon, SURGEON, surgeon. Surgeon means a person who performs surgery. Okay, surgeon, 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 comma, obstetrician, OBS, OBS, TETRICIAN, obstetrician, comma, physician,
surgeon operation.
Surgeon, comma, obstetrician, OBS, TETRICIN, obstetrician, comma, physician, 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 and pediatrician, 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 and pediatrician. Write down 4. Number will be Sarita, 4. In primary health center, there was only one medical officer. But in community health center, there will be 4 medical officer. One will be surgeon, one will be obstetrician, one will be physician, and the other will be pediatrician. So obstetrician is who? Obstetrician is one who delivers babies. Okay, they mostly deal with obstetrics, and gynae mainly deals with the pregnant women. Okay, physician is a person who will check your vital signs. Okay, who will give you medicines. They are mainly related with medicine. Okay, physician, a person for whom you can go for follow-up routine checkup. And next is pediatrician. Pediatrician mainly deals with the babies. Okay, there is a PICU and NICU. PICU is for above 5 years, and there is NICU, NICU, neonate for neonates. Okay, below 4 years of age, they are treated in NICU. If NICU, ICU means ICU itself means, what is the full form of ICU? Anyone?
Ma'am, intensive care unit.
Yes, intensive care unit, and there only critical patients are taken care of. Okay, if you and me go there, they won't keep us in ICU. Only if the situation is very critical and you need medical emergency, okay, then only the person is admitted to ICU. Their equipments are also very much different than the normal wards. Okay, so number 2 you write nurse midwife. Second point you write nurse midwife. Number 2 nurse midwife. 7 nurse midwife. 7 nurse midwife means the staff nurse, okay, who will be working there. Nurse midwife 7. Next, number 3 pharmacist. Pharmacist. Pharmacist 1. Pharmacist 1. Number 4 dresser. DRESSER dresser. Dresser 1. Dresser 1. A person who assists in dressing, okay, who will assist the surgeon in dressing is known as dresser. Dresser at 1. Next, number 5 laboratory technician 1. Laboratory technician at 1. Laboratory technician 1. Number 6 radiographer. Radiographer means radiology technician. Okay, radiographer RADIOGRAPHER. Radiographer at 1. Radiographer 1. Radiographer 1. Ward boys. Ward boys. Number 7 ward boy. WARD ward boy. BOY. Ward boy at 1. Ward boys, who are ward boys? They work in hospitals they are like peon, okay? They will bring the stretcher, they will assist the patient, they will take the patient from one room to the other to the physician, okay? They will bring in, just like peon, their work is like a peon only. So they are known as ward boys, okay? But they won't be dealing with all those ringing. It's not like a school. Hospital is not a school that you will ring the bell, you will go and bring pen, paper. That is the work of peon. But ward boys, they mainly assist in pulling the stretchers, taking the patient from one place to the other, from one room to the other. Okay, this is the work of ward boy. Ward boy at number 8, Dhobi. Dhobi. Dhobi, DHOBHI. Dhobi at 1. Dhobi is also required, who will be washing the clothes, hospital clothes. At 1. Next, sweeper 1. Number 9, sweeper 1. Sweeper 1. Next is Mali, MALI. Mali means gardener. Okay, Mali 1. Mali 1. Next is Chaukidar 1. Number 11 is Chowkidar, CHOWKIDR, Chowkidar, 1. Next is number 12. After Chowkidar, you write Peon 1. Peon 1. Next is, last one is Aya, AYA. Aya 1. Okay, so this is the staffing pattern of community health center. In community health center, there are many extra things. Okay, and like radiographer is also included here, dresser is also included, and the medical officer's number is also more in number than the primary, than the PAC. Even the staff nurse also, there is 7 in CAC, but in PAC only or ETA. So there is a difference. Okay, in community health center staffing pattern and primary health center staffing pattern. So now wait 1 minute. Okay, you just write down. I want to give you some 5-year plans. Okay, it is a table, so just write down 5-year plan. 5-year plans. 5-year plan. Underline it. 5-year plan. Write down. Planning Commission was established on. Planning Commission was established on. Planning Commission was established on. Planning Commission was established on March 15, 1950. March 15, 1950. To form FORM, to form 5-year plan. To form 5-year plan. Full stop. To form 5-year plan. Full stop. The main objectives. The main objectives. The main objectives are given below. The main objectives are given below. Write down number 1. Below you write number 1. Control and eradication and eradication. ERADICATION. Eradication of major communicable diseases. Of major communicable diseases. Full stop. Of major communicable diseases. Full stop. Okay. So what was the when was the 5-year plan established? It was established on March 15, 1950, and it has also given some of the objectives. Okay, health programs has given some of the objectives for the 5-year plan, and the first one is controlling and eradicating communicable diseases. Okay, how to control the communicable disease and also how to completely destroy. Eradicate means completely destroying the communicable disease. And first, before that, you have to do prevention. First, you have to prevent yourself from falling ill. Second is you should control. Next is you will have to try to eradicate. Now, communicable disease. What are communicable disease? Anyone? Can you give me any example of communicable disease?
Ma'am, chicken pox.
Hmm. Yes.
COVID-19,
Some
ma'am.
more? Yes, COVID-19 is also communicable. Very recent wala na? Communicable disease. Okay, communicable disease is what? That can spread from one person to the other, right? So whatever you said is correct. Next, any more? Measles, HIV,
Hepatitis, ma'am.
hepatitis, measles, chickenpox, smallpox, AIDS, right? All this all comes under your communicable disease that can spread from one person to the other. TB, okay, tuberculosis, all these are communicable. So how to control and then to
Ma'am, jaundice.
eradicate. So, huh?
Jaundice, ma'am.
Jaundice is not communicable. Okay. Next, full stop, you right. Next point, strengthening of the STRENGTHENING, strengthening of the basic health service of the basic health service through the establishment of PHC. PHC capital. Through the establishment of PHC. Okay. So the health services should be properly maintained. Health services should be strengthened so as to help the people more towards what? Why do you think health services should be strengthened? Hmm?
Control
Why do
the
you
spread
think
of
so?
communicable disease.
Control of communicable disease. And what more? Why do you think that health services should be strengthened?
Control and eradication, ma'am.
And if there are no health services in rural areas, will they be able to come to town every time and come for regular checkup? Will the pregnant mother be able to come daily for checkup? If suddenly something happens to her in the middle of the night, there is no hospital nearby, will she be able to go to the city for delivering her baby? No. So
No,
No,
ma'am.
because
ma'am.
of all these reasons, yes, health services should be strengthened. Okay. So these were some of the plans that they have made, and because of this, PAC, CAC, all these centers were built in all those areas, in all those local areas where the people can come instantly at any time, and even the cost is very low. Okay, cost is also very, it also depends on the cost of that place. Even if there is a hospital, but very costly and the family is not economically stable, then he or she will not be able to get admitted in the hospital because the price is too high. Hmm? So because of that, according to the place, they have put these centers so that they can come up there, or even all those NHM. Before it was NRHM, now it is NHM. So all these places, it's very much it's in budget, okay, low cost, and people can come and do their regular checkup in all these centers. So that is why the strengthening of basic health services is very much important. Okay. Number 3, you write population control. Population control. As we all know, India is the second most developing countries in the world. So controlling the population is very much essential. Okay, population control is essential, because how much population will be there, that many health centers will be required, that many schools, economic, okay, the economic, the governmental economics, all these things are very much important for day-to-day life, because whatever we consume, it is all through the government. If they increase the rate of petrol, if they increase the rate of vegetables, rice, but rice is the staple food of India. If the price of rice is very high, hmm, if the atta is very high price, then we will not be able to consume, because there are lakhs and lakhs of people. So what will happen because of this so many population, our population outburst, we will not be able to get all the things that we really need because of high costing. Okay, so population control is required. Hum do hamare do, that is the slogan now. So hum do hamare do is put forward. Only two child. Okay, a family should have only two child norm. Okay, population control. Number 4, you write development of health manpower resource. Number 4 is development of health manpower resources. Development of health manpower resources. Full stop. Manpower resource is also very much required. In a hospital, for example, in community health center, you have seen that medical officer Sarita ase. There is 4 medical officer. If by chance in medical officer only eta medical officer hole in community health center, will he or she will be able to look after that many people who will be coming? They won't be able, because community urban areas, there are lots of people control, lots of people in considered to PHC. Okay, in town, village, the population is less in village, then comes your town, then comes your city. So in village, the population, if it is 50%, is 20%, then in town it will be 50%, in city it will be 80 to 90%. So according to that, the staffing pattern is also required, manpower is also required. If there is a classroom, okay, for example, a class of 100 students, and only one teacher is there, will that teacher be able to take all the classes, all the subjects? And you have 7 subjects, for example, 8 subject ase, 100 students and only one teacher. I don't think the teacher will be able to take all the subjects. Either she will be good in one subject and the other subject she will just try to skip, because she will have to complete the course within the given time period. So manpower is very much required. If there are 100 students, at least there should be max to max 10 teachers should be there. 7 subjects are there, 10 teachers should be there, so that those 7 subjects can be taken completely. All the